introduce yourself.
Hi, I'm Christy, the Senior Center Director.
And what's going to happen is Kyle's going to talk for a minute or two without his presentation so that I can keep an eye on the waiting room and let in any stragglers. And then I'm going to switch over the Zoom host to Kyle, and he will then take over the screen with his presentation and try and watch the waiting room, because I can no longer see the waiting room once Kyle is the host. So with that, I'm going to introduce Kyle Brende of Amity Physical Therapy. And thank you very much for being with us for this Get to the Point of Health lecture. And we're really glad you're here.
Thank you so much for the introduction. First off, thank you, Jeanette. Thank you, Christy. Thank you, Pool, for having us here today. Obviously, this is a very important topic which affects, thousands of seniors across all the U.S. and the world, for that matter. Fall is a major issue that we deal with in physical therapy on a consistent basis. Statistical analysis shows 1 in every 4 seniors over the age of 65 falls every year. 3 million falls related to ER visits each and every year. And it's one of the #1 leading causes of death that we have. And it's very preventable at the end of the day. There's many, many different reasons why people tend to fall, which is what we're going to go through a lot of today. I welcome questions as we go through, and certainly, if there are different topics that we need to address as we get through the end of the presentation, I'm happy to go back through and address things either more in-depthly or address different questions as we have. But, I'm hoping to have a lot of informative information for everybody regarding different ways we can help to prevent falls in the home, prevent falls outside, different tips and tricks that we can go through, but also have a deeper understanding of kind of why do we fall and ways in which we can help ourselves. Like everything else in our spectrum when it comes to whether it be physical therapy, orthopedics, neurological stuff, or even internal medicine for that matter, no two people are the same in kind of causes of what will, lead to a fall, what will lead to tripping, what will lead to high propensity for a problem to occur. So obviously I'll put the disclaimer out there that if you guys ever have any questions or concerns, certainly consult with your medical team. Obviously I'm seeing many of you I've known for many years now. We're here now. I consider myself part of that team as well. I'm always here for anybody as needs arise. But, I want to make sure that, as a part of this community for the last 14 years since we've been in practice, that, we continue to be a part of this, and, look forward to being able to, do this, but hopefully many more of these in the future in order to help the community address many issues that come up across the board. I'm looking at Jeanette. You muted.
Where are you?
Are you ready to be host?
Yes.
I'm going to share my screen. No, I'm not. I'm going to make you the host. Okay, you are the host.
All right. So let me pull this up here, and please bear with me, guys, because this is my very first time actually being host of a meeting. So if I start messing things up, please bear with me. How's that? My PowerPoint up there?
Yes.
Okay,
Yep.
Very good. So let's see. Our slideshow here. Let me just get to our format. So staying on your feet and balance and fall prevention. Obviously I'm Kyle Brande. I'm with Amity Physical Therapy. I've been a physical therapist for 14 years now in the local community. I'm down here in Woodbridge on 1 Bradley Road. Contact information will be there at the end if anybody has questions or concerns and wants to reach out to me moving forward. What balance is our ability to stabilize ourselves, our equilibrium, our steadiness, symmetry, if you will. It's our ability to really stabilize our body throughout both dynamic movement and static movement. Our balance consists of a few different major systems: our vision for 1, our vestibular system for 2, and our proprioception for 3. Vision is particularly related to depth perception. How do we know where something is in our visual pattern? It actually correlates very heavily with how we balance. So if I can see the person in front of me is getting closer, I can sense I'm getting closer towards them. I must be leaning forward. Same thing if I'm moving further away, my balance is moving backwards. Am I suddenly getting closer towards the wall? my vision allows me to see that. So that's one of many senses that allows me to determine how my balance is situating itself. A lot of visual problems that can occur relate to blurriness, glaucoma, cataracts, double vision, nearsightedness, farsightedness, on down the line. Our vestibular system is one of our main sensory systems. It provides the brain with basic information about balance, about motion, about how we kind of load our body and unload our body, lateral movements, posterior movements, things like that. It's made up of the three major semicircular canals. One determines up and down movement, one determines side to side movement, and one determines for tilting side to side. Sacula and utricle are two other main organs within the ear, which also play a role in our vestibular system and balance. There's three main crystals that oftentimes people hear about when we talk about things that impact the vestibular system, like balance. So benign paroxysmal positional vertigo, BPPV, is one of the main things we'll see here in PT as a whole that will impact people's vestibular system, create dizziness and imbalance. But when properly utilized and when in proper health, our vestibular system really maintains our balance points and allows us to sense, hey, listen, am I tilting to the side? Am I having some kind of a disturbance in my system, which will tell me how I need to correct? So it gives a feedback system that we can then use to help load our muscles to make that self-correction. The last piece is proprioception. And proprioception is a very dynamic piece of our entire body in a whole. And oftentimes goes really underrated. So the best way to explain proprioception is that it's our perception and awareness of our body's position and movement in space. It allows us to understand where we are. So if my foot hits the ground, it allows me to understand the fact that my foot came to a firm landing. It didn't roll. It didn't land on my toes and land on my heels. That I'm stable and ready to transition to the next part of my gait pattern. Now, there's a lot of things that impact proprioception overall that include things like, different injuries that can occur over the course of time, different neurological processes, neuropathy, diabetic neuropathy is a big thing that a lot of us deal with over the course of time. So those are the sorts of things that oftentimes be impacted. Mediated by proprioceptors is referring to proprioceptors within our body, within our joints, within our muscles and tendons. They provide information on our limb velocity, on our movement, on the load of the limb, of how far we can push our limb. As an example, this would correlate to one of the main tendons we all know about, the Achilles tendon in the back of the calf. So when we look at the Achilles tendon itself, it'll have a little bit of a length tension relationship that will allow us to go through and see exactly how much load we can push forward on, how much further our ankle can move in order to allow that to occur. Bear me here for 1 sec, guys. Jack, you unmute yourself real quick? Sorry about that. Sorry, guys, I'm just getting used to admitting people right now. Continue forward here. So why is balance important? Because it impacts everything we do. We can't do anything in life without proper balance. We can't walk. We can't go through our daily routine of exercise. We can't go through getting out of a car. We can't go through and create our normal going up and down stairs, dressing, taking a shower. All those things require stability and balance. Balance allows us to do all these things. And again, it's great, but when it becomes a dysfunctional system, it can create a lot of problems. It can create a lot of uncertainty in how we move and a lot of hesitancy in our movement. Our body is used to fluidity as a whole. From the time when we're infants. So I've got a 6-year-old and a 2.5-year-old. And when they were obviously little, like we all were, and like our kids were, our grandkids are, they fall a lot. Well, why? Because they're trying to relearn our system. They're trying to figure out how is it that we're able to allow our body to uptake this information and create the proper responses to basically to stabilize, to allow us to move the right way. When my little guy Lincoln was first learning how to walk, he'd slip and fall a lot, but then he'd get back up and he'd do it better the next time, the next time, the next time. Unfortunately, in order to relearn in our systems right now, falls have a much deeper impact, potentially for fractures, deeper injuries, bruising, hitting our head, creating concussions, and hematomas, things of that nature. So there's a lot of different things that we need to be more concerned with versus when we are, little and we're, pliable and malleable and like high bounce balls that we just bounce right back up. Impacts of balance are disease, illness, surgery, weakness, lack of mobility and movement. I would say if you don't use it, you're going to lose it. When we look at the different levels of, illnesses that will occur, you can look at things, again, like we're doing right now with COVID-19, flu-based symptoms. They can throw a lot of our body's processes for a heavy loop and, get to the point where we're not actually creating that functional stability that we're looking for. Diseases like multiple sclerosis, cancer, emphysema, all have an impact on how we balance. If we're not breathing properly, people underestimate this stuff all the time, even in orthopedics. Or if we're not breathing properly, it creates dysfunction in our system. It actually can create almost a hesitancy in our movement because there's a natural flow to how we breathe and how we move. Surgery is a big one. A lot of us have come off of different surgeries over the course of time. Common ones we see in our senior population: total hips and total knee replacements, ankle and foot surgeries, bunionectomies, ligamentous repairs, things like that are very, very common to see. And I'm sure, as many of you can attest to, coming off of those surgeries, balance is not there. People don't feel steady on their feet. There's a reason why we come off and we end up using walkers or canes for more prolonged periods of time, because we're trying to figure out our balance. Weakness, I've always said, is one of the number one biggest concerns we have here, is how do we create stability through muscular strength? But also, how do we then put that into play through the ability of our body to go through its natural processes and promote itself in a way in which will allow us to stabilize, will allow us to put that strength into functional use and not just have it be something where we kind of get caught in the cycle of having good strength, but we push off and can't balance ourselves. Center of gravity is a big point that oftentimes in PT we work on tremendously. When we look at center of gravity, it's a point of which our weight is centered over top of our feet. Now, this almost occurs in a cone-like shape, and you'll hear me refer to this as your cone of stability. So when we look at this little cone, as we see in this picture here, if our body weight is outside that cone, it's going to change the angle at which that cone allows for stability. So cone of stability is the distance we can travel beyond the center of gravity before we end up losing our balance and falling. It's different for everybody. You'll see, different people be able to really kind of go out way in front of themselves on a balance point versus other people where it's much less room for error. All the different factors we talked about up to this point play into this overall. So your strength, your stability, your vestibular system, your visual input, your proprioceptive input, all work in conjunction with this in order to allow us to either ebb and flow throughout our day, but throughout our stability points. When we look at posture and its role in balance, people underestimate this constantly. So posture is both static and dynamic. This is one of those points I talk about a lot with people of all different sorts, whether it be balance related, whether it be related to back pain, neck pain, shoulder issues. People think of posture as a static positioning. How am I sitting here in my chair? Am I sitting with my shoulders rounded forward, with my head down? Am I upright with my chest out? But posture is really a dynamic process overall as well. The common examples we come up with for posture that we kind of come into outside the norm is either kyphosis, which is more the rounded shoulders and the forward head. That typically occurs mainly at our thoracic spine. So that'd be that second picture in from the left-hand side, where we tend to see more of the curvature of the spine going forward, drops the head and the shoulders down. And that's going to put your weight more over top of your toes. When our head and shoulders come over top of us, we're naturally going to go forward. So that creates its own problem as far as stability, because where do we tend to lose our balance most? In my personal experience, we tend to see it more going forward. So if we are not promoting ourselves to remain more upright in back, we're going to tend to lean and tend to go forward. Also, because that's where we can see. So if we're going to pick a spot of comfort level, or where do we feel comfortable with kind of hedging our bets? Most people tell you they don't feel as comfortable when it comes to leaning back, more that sway back position. That would be the fourth picture in, where the lower back is more extended backwards because we can't see what's going on behind us. We lose that visual input. It's easier to see when we're leaning into something versus how much further we're getting away from something. Another common example of postural dysfunctional occurs, we tend to bend our knees a lot. And again, that can be related to instability, lack of knee extension from osteoarthritis, degenerative joint disease, other dysfunction. Certainly other diseases like Parkinson's tends to have more of a stoop posture with hyper knee bend. So those things are common to see as well. Why do we fall? $1,000,000 question. We're going to see this for a lot here. So let's go through some common examples of why we tend to fall. Tripping is one of the most common things we tend to see. Ability to clear our feet, oftentimes caused by weakness, immobility, fatigue, and not being fully awake. We tend to see throw rugs and mats be one of the most common things that people trip over the top of, mainly because they have a lip on them that if we're not careful, we can catch our feet on. If we don't clear our feet well, that will allow us to actually catch our toes right on them and then end up tripping over top of that. Obviously, a lot of us have pets. I'm a huge dog lover. I love having dogs run around, but oftentimes, if you're not paying attention, they'll run right in front of you and flip your feet off underneath you, or you'll trip right over top of them. So it's important to understand where animals are as they're kind of running around as they're around us. Cords, baskets, clothes on the floor, toys, whether it be pets, grandkids, my kids, all the above. Also, one thing that goes very underrated in my practice, when I hear patients say, hey, I fell, one of the most common times is I got out of bed in the middle of the night, had to go to the bathroom. I'm sleepy, I'm groggy, I wasn't fully awake, didn't put my glasses on. Because that's a point in which we don't have our full vestibular system on board. We've been laying down for prolonged periods of time. Now we go to sit back up. Our blood pressure hasn't quite fully come back up. So we go almost into this hypotensive state where we get a little dizzy, we get a little lightheaded, but I still need to, get up and go. We forget to grab our walker and our cane. My grandmother, she was on crutches for my entire life. Part of the reason why I'm doing what I do today. I can't tell you the number of times I had to go over and help her off the floor because she would forget to grab her crutches when she got up out of bed at night, especially if she had dementia and Alzheimer's later on in life. She literally forgot that she needed them after 45 years. Also, just rushing. That's a very big thing. If you're in a rush, you're not paying attention to all the other dynamics of how we balance and how we stabilize ourselves. Medications. How many of us are not on medications at this point in our lives? One of the most common side effects is drowsiness. That'll lead to just what we talked about before. Sedatives, tranquilizers, sleep medications are very common things that will create, again, that drowsiness side effect. Muscle relaxers. In the orthopedic realm, muscle relaxers are one of the number one reasons why people have issues like this that normally don't, even in younger populaces, because they tend to be groggy, more that snowed effect, because it relaxes the whole body. Your muscles are not on point as much in order to allow your body to actually facilitate what it needs. Anticholinergics, opioids, diuretics. Obviously, opioids, thank God, are less a part of society these days, but still, again, they have more of that sedative effect on us. Lack of improper use of or over-reliance on assistive devices. One of the number one things I talk to people down here about. We forget we need one. The walker cane is too high or too low, which is indicated in this picture right here. You can see where, again, that correct level point of where an assistive device should be roughly at your wrist line if your arm is down at your side. If we're holding our cane up here, we have no leverage point. We can't push it down in order to actually leverage it back up. Same thing with a walker. It's all about how do we create balance. But if the cane or walker is up high and we're having to almost have our elbow up, we have no real great ability to push down. Same thing if it's too low. We're kind of leaning down into it. That changed our balance point and shows us off kilter. Using when we don't need it is also a very big problem that we run into. A lot of people feel like they need to kind of take it just in case. What that always tells me is we have a lack of confidence in our ability to move and our ability to facilitate our movement. Then to carry it, forget to move it forward, can create more of a risk than going without one. I would always tell people they'll consult with your PT first or your doctor ahead of just discharging a cane or a walker, because oftentimes these things can create, again, they might be in place for a different reason, or there might be other things that maybe on my end I'm seeing that I would say, hey, we still need to keep that for a little bit longer. Underlying medical conditions, hypotension we referenced before, which is, again, low blood pressure, other heart problems, urinary tract infections, anemia, pneumonia, strokes, including mini strokes and transient ischemic attacks or TIAs. are all common reasons why people tend to fall. As you can see from the graphic, the rates of falls and death rates have increased 30% from 2007 to 2016. That's a staggering statistic right there, and one that we should all take note of. Falls have a very high propensity of leading to, again, really negative side effects. Sometimes it can be fractured bones, sometimes it can be concussions, but it can also lead to death. And it's one of the reasons why we tend to be very proactive down here about how we address balance and fall prevention. Weakness is a huge component to why people fall. People lack the stability overall to hold their body in position, whether it be statically or dynamically. They can't control their body within that cone of stability we were talking about earlier, or postural control. Also, legs giving out, and that can be muscular or neurological. When we look at the reasons why legs give out, it can certainly be more related to things like, lower back issues, radiculopathy. It can also be related to just, hey, listen, my legs can't hold me anymore; they're too fatigued. Again, neurological conditions like peripheral neuropathy, strokes and TIAs, Parkinson's disease, which we're shown here is characterized by that stooped and forward posture, what we call festinating gait, which is more of a shuffled gait and difficulty with initiating movement, muscular weakness, and then Alzheimer's and dementia is also a big issue. If we forget that we have balance issues, we're not as likely to go through the process and actually understand the fact that we need to be able to stabilize that. Why do we fall? The neurological weakness. This is a big point that we contend with a lot. Lumbar radiculopathy, disc herniations, these can lead to things like dropped foot, knees giving out, lack of glute control, which will, if you ever hear me talk a lot about lower back pain while we have it, you've heard me say that our glutes are one of the number one reasons why people have lower back pain. If we don't have strong glutes, they cannot hold our back and body upright. Our glutes really prevent us from tipping over on our waist. So when we go through and really work on strengthening and stability, glute control is huge. And that's one of the number one things that we need to do. Improving posture, like we talked about earlier, moves the weight back over top of our base of support, keeps us within that cone of stability. It's the easiest way in order to improve balance and reduce your fall risk. Posture is simple in the grander scope of things to make mild changes that are impactful. It doesn't take much. It can easily be from just going from a more stooped position and just kind of straightening ourselves up. It's one of those things we can do it all day, every day. We can make a big change. If you thought about almost somebody had a marionette string on top of your head and pulling you upright before you started to walk and you got yourself in a better postural position, that will reduce your fall risk right away. Easy to do, okay? Not hard to correct the position. You don't have to be perfect with it. Even small changes can bring you back further within that cone of stability into a more stabilized position, which will allow you the ability to actually go through your process of walking, standing statically with less chance of falling.
Kyle, can I interrupt for a second?
Sure can.
There was a question in the chat from
sorry.
Carolyn, and she's asking what you think of new type canes where you stand up straight. And I'm not sure if there's more information, but maybe you know what she means by that.
Can you repeat that one more time there? I missed that.
It's in the chat. It says, Kyle, I was wondering what you think of those new type canes where you're standing up straight.
So those have actually been out for a little bit now. And like everything else, I think every cane assisted device, for that matter, has its point, has its purpose. I do think that being more upright will always allow you to be in a better position because, again, the common problem that people run into with canes is that they tend to be more hunched over. Some people I've had that have utilized, again, more of a taller cane or more of a walking stick type of mobility, is that they feel like they can kind of plant it and then push off of it and pull off of it. Sometimes, depending upon your grip on it, that can give a little bit of a false sense. I think like everything else, for more mobile people, that can certainly work. But if we're looking for, let's say, more of a somebody who has, let's say, lateral glute weakness, hip dysfunction, let's say for somebody with a stroke that has hemiplegia, that has more of a tilt to one side where they have to kind of brace and kind of pull themselves back up, that's not going to work as effectively as something on their opposite side that they can push off of in order to help support themselves. Hope that answers the question there, Carolyn. Exercise to improve your posture: scapular retraction, shoulder extension, shoulder flexion, shoulder abduction, shoulder shrugs. All these are kind of listed down from top to bottom here. But all the exercises are really meant to work on scapular muscles to basically draw ourselves backwards, upwards, and create more of a mobility up and forward for ourselves. Support the shoulders, support the head and neck, and put ourselves into a better position to hold ourselves against gravity.
Kyle, excuse me. I lost the screen for some reason.
Okay.
I see the people here, but I don't have my screen.
Is anybody else noticing that, or Jen and Chrissy maybe be
Is
able to
it
help them?
my end or everybody else's end?
I still have his screen.
I do too.
Okay.
All right. Okay.
Jeanette, do you have any suggestions for him?
I do not. I'm baffled.
Not to worry.
I don't,
Actually,
at least from my
I
perspective.
think- Try moving your mouse a little bit. You may have just wandered out of the screen area.
You're right. Let's try that. Yep. Bingo. Thank you.
Okay.
Hey, yay me.
So as we go through, and we're talking about posture again, how do we also prevent falls just through postural control alone? Simple things like tucking your hips in reduces your kyphosis, that forward position of the hips, and improves your lordosis. Oftentimes we talk about a anterior tilt versus posterior pelvic tilt, kind of tipping the bucket in a sense of our pelvis forward or backwards, and that can change again that center of stability based off that alone. Allows you to stabilize your trunk against perturbations or loss of balance. A perturbation being something that kind of knocks you off your center of balance. That can be somebody bumping into you. It can be you bumping into a wall. Your dog hitting your leg, things like that. We have to work on our balance, and that sounds basic. But most people will avoid working on their balance because they have a fear of that loss of balance, fear of falling, and they don't understand how to do it in a safe way. It's one of the number one reasons why people seek out consultation from a physical therapist for balance-based issues. Our job when it comes to helping people get back from a lack of balance is to put your body into a position to make you feel unbalanced while keeping you in a safe environment to do so. Your body has to know what the unbalanced feeling feels like to relearn how to correct it. So this goes right back to what I was talking about earlier with my son learning how to walk. If he didn't learn what it was like to fall and be unbalanced, how would he know how to stabilize himself and to progress forward from there? We're working in reverse. We have now learned what it feels like to fall and what it feels like to be unbalanced, and that's preventing us from stabilizing. We have to relearn what it feels like to be unbalanced and how to pull ourselves out of that position. Ankle, knee, and hip strategies is something we discuss a lot, and that's referring to the initial response of our ankle and feet to what we call ground reaction force. So when our foot hits the ground, what does our ankle and foot need to do in order to help us stabilize? That information needs to occur instantaneously in a feedback loop from our brain to our spinal cord back down and up consistently. Once we know that a force gets past that and our ankle and foot can't stabilize that, now it comes up to our knee. What does our knee do at that point in time? Does it fully extend? Does it fully flex? From there, what does our hip do? Does our hip kick in with more abduction or adduction? Does it extend further, flex further? Does it create rotation or lack thereof? So it's all about how does our body respond? All these strategies can be learned from the ground up and then relearned again when they get lost. They have to be done in the right way in order to really sequence them appropriately, because if your knee is kicking in harder when your ankle and foot should be kicking in more, we're going to have dysfunctions there. Our ankle and feet have much smaller muscles for more fine motor control, much like our hand and wrist do. Our knee and our hips have much larger base muscles for creating more force and stability that way. So if we're not allowing the fine motor control to do its job, and we're trying to kick in bigger muscles for that, we're going to be off balance too. Some of the key exercises that we work on for this come down to things like single leg balance. I always advise people to try this during times when we're just doing our normal daily activities, brushing our teeth, things like looking in the refrigerator, common thing I like to do, talking on the phone. All these things are good ways in which to take time when we're not focusing in on our balance to then have to do something else. That is really what balance is for us. It should not be a primary thought process we have to think about and focus in on. It should be a background mechanism that our brain just kind of takes care of on its own. Our muscular system takes care of it independently. If we're thinking about balance and how we're going to balance to make this next move, we're already 2 steps behind at that point in time. So simple exercise will also be sit to stands, going from a sitting position on upwards. Now, if you notice in this particular picture, the gentleman is getting his weight up and over top of his toes, and then he can extend it and use his glutes more. Common thing that we tend to lack when we lack balance, we lack the ability to even just go from sit to stand easily. And that can occur from orthopedic conditions, neurological conditions, and everything in between. Same thing with just doing a basic step up. You know, I think that we take for granted sometimes the use of railings or our cane or our walker and how that helps us to be able to load and stabilize ourselves. Trying to go up onto one step from your landing up onto the first step and not hold on to anything is actually a great exercise in order to help to retrain your body and how to make that propulsion. Much like sit to stands, it should not just be your thighs that are doing the work here. You should be incorporating your glutes and utilizing them to help to force you actually almost upwards and forwards, almost like a 45-degree angle in a sense. So that's a common thing we tend to work on a lot with patients here. Squats. If there's any exercise you're going to do, squats is it. There's a lot of different ways you can do it. You can do it with a chair and a counter for stability. You can do freestanding, arms overhead, holding a weight in front of you to add some extra resistance, holding weights at the side for heavier resistance, even things like TRX, which is a common thing you'll tend to find at most gyms, certainly in our rehab facility, but commonly a lot of people have this at home. Squatting mechanics are important. A lot of people tend to try and squat just more straight up and down, utilizing their thighs, and they end up having their knees go out over top of their toes. We want to try to have the knees staying in line with the toes or slightly behind, heels staying flat on the floor. You want to try and hinge more at your waist than at your hips. You want to keep the back straight and prevent, again, that forward positioning, that rounding at the shoulders. You can keep your arms out for balance. You can keep your arms at your side. You can keep your arms crossed in front of you or up over top of your head. All just add different challenges to the squat mechanic, but can all be beneficial for you. Bridges is a commonly utilized exercise in order to re-engage gluteal muscles, extend the back, extend the hips. And what was one of the number one things we were talking about with posture was extending our hips and creating an upright position. This is a great exercise to do so. And for most people, it's great for their backs, great for their knees, and great for their hips overall. Safety lunges is a type of lunge we utilize a common surface to hold on to again, increase our stability. Now, this particular picture, I had a love-hate relationship with when I found it, in the sense that I like the fact that she's utilizing a countertop to hold on to, but the lunge is actually pretty deep on this. I would actually tell people not to normally go that deep in a safety lunge, more of a weight shift onto the front leg and then push back up from there to a neutral position. So that way you have a sense of that forward movement and then that return back up to a neutral position where both your feet come underneath you. Unstable surfaces are a great tool to make you feel imbalanced. Again, these are things that should normally be done, with a PT around to make sure that you're safe with them, unless you're really experienced with them or unless you're feel very comfortable with them. A pillow can be used, a Bosu ball, AirX pads are all common things we tend to utilize clinically in order to help create a unstable surface underneath the feet that is going to then force your body to fight against those unbalanced changes and then hold yourself stable in position. Challenging walking stability. So we do this through things like sidestepping, walking backwards, high knees, grapevine or karaoke, as you're kind of seeing in that picture right there. We're kind of crossing one foot in front of the other and then restabilizing. It's very common that we tend to trip when our legs get crossed up, right? We tend to take a step forward and, we lose our balance. The other leg comes across it. How do we know how to get ourselves out of that position once we've kind of practiced that, retrained our body in that? So that's a great exercise to work on as well. Balance matters at the end of the day. It is the root and foundation of everything we do. And we have to build our body on a solid foundation. If not, it doesn't matter how strong we are. It doesn't matter how long we can bike for. If we can't walk, if we can't stabilize, if our core stability isn't there, then it's not going to allow us to function the way we want to. At the end of the day, that's what we're all looking for. We're looking for quality in order to allow us to address what we want to do, whether that be sports and recreational activities, golf and tennis, swimming, whether it be going, out for a walk on the trails we have around here, whether it be just being able to go to the grocery store for ourselves and be independent in our living. All these things are very important. Like I said before, there's a lot of different root causes that we can get to as far as why balance issues occur. I would always recommend that you consult with somebody in order to figure out why your balance is occurring the way it is. Because there are many, many different reasons why that can be. If you're experiencing balance issues, don't wait on them. There's no reason to. I know in the past, one of the common things we've talked about with a lot of patients is why do we wait? And to me, it's something where I think in orthopedics, in particular outpatient practice, it's commonplace we tend to wait on something assuming it's going to get better on its own. Many things don't. There's no problem with getting into something early. I actually encourage that. Why wait on a muscular strain to impact something like balance and prevent us from walking? Why not jump on it when it's painful? When we start to feel like, hey, it's been 2 days, I'm really not balancing well. Why not seek out treatment for that? Beautiful thing is, at least in PT in our practice, you do not need a physician referral. You can call us up directly. All my contact information is here. If you ever have questions, Christy and Jeanette can certainly forward you my contact information as well. I hope this was informative for everybody. I hope that this was provide some insight into maybe why people, either yourself or your loved ones, are struggling with balance. And certainly I'm here to answer any questions and concerns.
That was great.
Thank you.
Does anyone have any questions for Kyle? No, thank you, Kyle, so much. It was wonderfully informative.
Oh, our
And
pleasure.
Carolyn sent a message.
Hold it up there. One sec, Carol. I'm having trouble with accessing that here. Bear with me.
I'll read it for you. It says, Kyle,
Thank you.
thanks so much. I always learn something new from you. I never made the connection that my bouts of dizziness are most likely to happen when my chronic ear infection flares up. If anyone else has a comment, they can put it in the chat or they can share it now. I also want to thank you, Kyle. Some of my best days were spent down at Amity Physical Therapy getting better and seeing all my friends there. So it's a very popular location for people my age.
Listen, it's our pleasure. We certainly consider ourselves part of the community here, and we're in a position where I really feel like we can help a lot of people with this sort of issue. Hopefully, at some point in the near future, we can do more lectures like this about different topics. If there are certain things that people are struggling with that you feel would be important to hear about, I'd love to speak further on stuff. But certainly, if anybody has specific questions or concerns that they don't want to address in a public forum right now related to their own health and well-being, feel free to reach out to me, 203-389-4593, or you can email me directly at Kyle, Kyle, at amitypt.com.
Great. That's especially important for those who are watching this home on Channel 79, and we want to thank Pua Ford for broadcasting this on Channel 79, and it will be rebroadcast. Pua has a recording of it, so hopefully we'll be able to run this again for those who missed it today.
Thank you, Kyle.
Thank you so much for allowing me to be a part of your day. Hope everybody has a great weekend.